Oh, hi. I'm Indranil Chakravorty. I'm a chest physician and I also do acute medicine. I work primarily at St. George's University Hospital in South London. I'm a professor at the University of Hertfordshire and I run a clinic for respiratory and sleep disorders in Pine Hill Hospital in Hitchin. Long COVID is a condition which has been exercising a lot of us around the world. Before we get into long COVID, I'll just briefly mention the fact that COVID is the viral illness which was originally recognized in December 2019 in China, and from there has spread across the world and has affected almost every country. We know that in the United Kingdom, we've had two major surges of COVID. Firstly in March, April in 2020, and again in December to February in 2021. So what is this infection? So it's caused by the SARS coronavirus version 2, and that causes a multiple system illness, can mainly affect the respiratory system, but can affect almost every other part of the body. Now, COVID, as we know, can affect anyone, but there are particularly some people who are affected more than others. So people who are of the older age group, people with some comorbidities such as diabetes, obesity, hypertension, kidney disease, heart disease, tend to do badly with COVID. Although the spectrum keeps changing, and we now know that COVID affects younger people, even children, and in different ways. We also know that a small proportion of people, maybe up to a third, tend not to have any symptoms or have very mild symptoms, so they may not be aware of this. And we've all heard of the multiple mutations or variants of COVID, and as we get to know each particular variant, there are different variants which keep coming around with different types of effects. So COVID as an illness is expected to last from 10 to 14 days. It's usually appears within about 5 days. Most people get better between 2 to 4 weeks. So COVID illness we consider to be something which lasts up to 4 weeks. Anything above 4 weeks we consider to be post-COVID, and some people experience symptoms for up to 3 months. And almost 90% of people would recover fully by the end of 3 months. And there is a small proportion, around 10%, who would continue to have symptoms beyond 3 months. And that is what we define currently as long COVID. So these are people who have ongoing symptoms related to COVID, which last beyond 3 months. It does not mean that they have persistent infection. The infection is usually gone within 10 days. It's usually what means is that the body is still reacting, and the immune system that was activated during COVID is still continuing to show signs and hasn't completely abated. So that is what we would define as long COVID. So more than 3 months, continuing symptoms of COVID, and we can talk about the symptoms of COVID and long COVID later on. And so let's begin with just reminding ourselves of what are the common symptoms of COVID. Now, if you look at the World Health Organization definitions or the Center for Disease Control in the US definitions, active COVID involves fever, cough, breathlessness, and usually other symptoms like headache, fatigue, and muscle ache. So these are the sort of common symptoms. The other key thing about COVID is the fact that most people experience a loss of loss of sense of smell and a loss of taste, which is a very, very common symptom with coronaviruses, particularly with COVID. So these are the key symptoms. More rarely, people experience other symptoms like chest pain, cardiac disease, diarrhea, vomiting, abdominal pain, liver involvement, sometimes kidney involvement, and in some patients, a bit of confusion. So they are more rarer symptoms, but they are present in COVID. Now, when people recover from COVID, we expect that majority of these symptoms have disappeared. The symptoms that usually tend to last longer are fatigue, breathlessness, occasional chest pain, headache, and this loss of taste and the loss of sense of smell. They are the ones that tend to continue. And a lot of people, maybe about a third of people with COVID, having recovered, will continue to have symptoms for up to 3 months. Beyond that, when we get into the long COVID territory, the symptoms which are most common are breathlessness, the loss of taste, and loss of sense of smell. They are the commonest ones. And along with that, just body ache and fatigue are the other two common symptoms that continue into long COVID. So majority of patients with COVID will experience that. Occasionally, some people experience chest pain. Occasionally, some people experience a bit of fever, occasional rise in temperature, maybe some sweating, but they are usually for a few hours and disappear completely after that. So they are the main symptoms of COVID beyond the 3-month period when we get into the long COVID territory. So we don't know enough about the long COVID yet. We are learning, and there's a lot of information being gathered about this. So what we know at present is that we expect 10% of people, and just to mention that there are some younger people who have had mild disease, mainly more common in women, who tend to experience more fatigue and headaches and symptoms beyond that. And there's also a group of people who are in the older age group, so let's say above the age of 70, and there are more men who tend to experience more COVID symptoms. Now, it's important to distinguish one thing from long COVID, which is the post-COVID symptoms. Now, some people who've had really severe disease during active COVID, so people with lung disease, mainly lung inflammation, tend to have a sequelae after that. So they tend to have some scars that are left in the lungs, and they may continue to cough, and they may sometimes produce phlegm. They may have breathing difficulty or exercise difficulty, and that is due to the damage done to the lungs due to COVID. And that is not what we would describe as long COVID. So that is just the effect of COVID, and there are a small proportion of people who will continue to experience that, and they will be dealt with in respiratory clinics or other general medical clinics in hospital. Long COVID is, as I said, it's a very distinct picture where the effect of the disease is gone, the virus is gone, but the symptoms continue to persist. Now, before we get into treatment of long COVID, we just need to be sure that there are no ongoing inflammation within the body. So we do some blood tests, make sure they are clear. We do some lung function tests, make sure that the lungs are okay. We may do some imaging like x-rays or scans of the chest to be sure that there are no residual scarring left in the lungs. And once all that is cleared, we are talking of long COVID, which is the symptoms of COVID. Now, can this be treated? So yes, it can be treated because the focus of treatment, because we don't have a virus to kill, the focus of treatment is going to be on symptoms. So if you take the main symptoms, so fatigue and breathlessness are the sort of most common symptoms, and the way to manage that would be with rehabilitation. So like in any other condition of chronic lung disease or heart disease, we would focus on recovery of function through a graded form of exercise. And this will involve going to a rehabilitation class, having personal trainers, and working out a scheme of exercises which will gradually help to recover function. And these exercises tend to be done in short bursts, not really exhausting. And we will try and build on, let's say, 5 minutes 3 times a day, building up to 10, 15 minutes, and then gradually over the weeks build up to a normal function. One of the things to remember here is that the focus of exercise is not to build endurance or to push people to the limit. We know that if you push people to the limit in post-COVID syndrome or long COVID, they would tend to become worse. The symptoms usually get worse. So the idea is to do it gently, do it in graded fashion, and always stop before you reach the point of 80% or 75% function. So that is how you build it up. And if you feel particularly exhausted the day after a form of exercise, the idea would be to rest and recover from that. The other simple things like chest pain, cough, breathlessness will gradually recover. If one needs to take any management, we would do symptoms like paracetamol for headache. And if anybody has any gastrointestinal symptoms, then, again, taking antacids or taking things to help settle the stomach, and others would be a way forward. So the medical community, doctors and nurses are really learning very fast. We are almost every time, every month, we learn new things about COVID. We learn how new drugs are being trialed, and some work, some give us promise, and then unfortunately turn out not to be very useful. So we are learning. The whole community is connected across the world, and we are learning from every country that we can. So anything we say now may become irrelevant in a few months' time because the science would have moved on. So we are really excited by this thing, but we're also really worried about our patients and about ourselves. So most of the doctors and nurses many have experienced COVID. Many have seen colleagues who've succumbed to the illness. So there is a degree of anxiety, fear, distress, which exists among us. We have great hope in the fact that we believe vaccinations are the way out of this. And the more the people are getting vaccinated, the more we have reason to be cheerful about, because we know that patients will no longer suffer the serious consequences. And we are really pushing for all our patients and family, relatives, friends to go and get vaccinated. So I'm sure that would be a message. So that's one of the key things. How we are preparing for this is we are preparing in two ways. One, we know that COVID has overtaken every other disease and every other condition that we treat in the last year. And we know that that is not a good thing, because there are people with cancers who are being missed or who are sitting at home unable to be diagnosed. We know that there are people with heart disease, lung disease, kidney disease who are not getting the best treatment, and that worries us. And we are trying to recover our services and restart normal services so that a lot of other conditions are not ignored. So that is one of the areas we are focusing on. And the other area is we are trying to make sure that we learn very quickly, and every time something new comes along, we are prepared to use it. So we are preparing to put all our patients into trials, and therefore we can use the latest and the best treatment for them across the world. And that is the other bit we want to look at. And we are worried about things we don't know. So what we are worried about is the new mutations and the new variants which are coming, and what else it might do. I'll give you an example. In the first surge, we didn't know much about thrombotic episodes. So these are clots which form in the body and can go up into the lungs and other parts. We didn't care much about that because we didn't see it. In the second surge, that was one of our biggest worries. We knew that people were, even if they were recovering from COVID, they were being severely affected by clots. So we started treating everybody with anti-clot mechanism medication. And that was the second surge, biggest thing. And we think that a lot of lives were saved because we were treating people for clots or looking for clots in everybody. So I remember everyone coming in, we would do scans looking for clots. So that's another thing. Now, we don't know what the third surge will bring, and if there is going to be a third surge, we hope not. But we will be looking for any new ways the virus is affecting the body and how we can treat it. So that's in a nutshell what doctors are thinking. Does the COVID vaccine affect long COVID is a good question. I don't think anybody knows the answer to that. What we know is that whichever type of COVID vaccine you may have access to or you've got a chance to get, we know that it does two or three things. We know that it reduces the risk of getting COVID. So it reduces your infective risk. So it protects, improves your immunity to COVID. So we know that. So again, the second thing we know is that if you do happen to get COVID, in spite of being vaccinated, which is a small proportion of people, we know that the COVID, the COVID disease itself is going to be attenuated or less than it would have been if it was wild COVID. So that's something we know. And the third thing we hope is that people who have been vaccinated and then unfortunately get COVID, actually their risk of dying from COVID is also going to be less. So those things we definitely know. Now, we know people who get very mild symptoms or maybe sometimes no symptoms who also get COVID. So in those situations, we're hoping that the vaccine will prevent that from happening. And we're hoping that therefore the risk of getting long COVID in that particular group of people who either are young and have no comorbidities and just get mild disease actually will no longer suffer the long-term consequences of COVID. Now, has that been proven? Not yet. We don't know enough to know that, but knowing how the vaccines work in order to block the attachment of the virus onto the to the receptors, we expect that they will then also stop people from getting COVID and therefore the effects of long COVID. So the answer is we are hopeful and we expect people to get less long COVID risk, but we don't know for sure yet. So it's a good question. So the question is, if I've been vaccinated and I get COVID, can I transmit the disease? Now, we know that all vaccines have 80 to 90 to 95% protection. That still means that there is about 5, 8, 10% of people who even after vaccination are still going to get COVID. And we see that all the time. So if you've got COVID, which means that you've got an active virus within you, the virus is multiplying, you are shedding that virus. So irrespective of whether you were vaccinated or not, if you are unlucky to get COVID, then you are at the same risk to everyone else as you would be. So you would have to take the same isolation and protection, infection control protection that needs to happen. So the only hope is that you have less serious disease. But if it hasn't stopped you getting COVID, then you are likely to spread it. So I think that risk still exists. But remember that risk is only in the first 10 to 14 day period. So after 14 days, majority of people will stop shedding the virus and therefore they will no longer be infectious. Now that also, in medicine, there is nothing 100%. So we know that there is a small proportion of people who shed the virus for a longer period than 2 weeks. So we expect 95% of people will stop shedding the virus by 2 weeks, but there are some people whose immunity is not strong enough, who are not able to clear the virus adequately or kill the virus adequately. So they will also continue to produce virus and be infectious moving forward. And you may have heard of a study in Brazil where they looked at health workers who had COVID and had been vaccinated. And they found that people who had COVID and been vaccinated don't tend to get COVID next time round. But the group that have not been vaccinated but had COVID, actually there's a 30% chance of getting COVID again. So that is 6 months later. So we know that whatever protection having COVID or the vaccine gives you, we know that that protection is going to go off in about 6 months' time. At present, the 6 months is an arbitrary thing, but we expect that your risk continues to be there after that period of time. Obviously, that would be variable. So one of the concerns that some patients are reporting or experiencing in post-COVID or long COVID symptoms is about hair loss, and or what we call alopecia. Now, hair loss is a feature of any serious illness. So we know that when the body goes through any serious illness, the blood supply and stuff to the hair producing follicles all are reduced, and most people will end up losing hair. Some conditions like malaria, typhoid disease, and many infections also lead to a position where people lose hair. We also know that in illnesses where, for instance, cancer and chemotherapy, which then stops the production or reproduction of cells, can also lead to hair loss. And similarly, in COVID is a very serious illness. It's a very inflammatory rich illness where there's a lot of cytokines, which are these inflammatory cells and particles which are going through the body, will tend to lead to a reduction or a stoppage temporarily of the hair follicles from growing and producing hair. So that is relatively common, and it's not unexpected, and we've seen it in many other conditions. What is important is that once people recover from COVID, that hair will grow back, and that effect of stunting or slowing down of the reproduction of hair or the falling of hair will recover. And there are now reports of people who have lost a lot of hair and then have recovered all of their hair, as happens in chemotherapy when people recover from chemotherapy, or people have recovered from other illnesses. So my only reassurance would be that it's temporary, and once the disease is done, you would expect within 6 months or so for the hair recovery to continue as normal and all of that to be in the past. So there is hope. So interesting. So there are two groups of people. One group of people are who have had access to testing. So these are people with symptoms who had been tested at the right time and then have turned out to be positive, and therefore they know they've got COVID, and therefore for them to move forward, that is relatively easy because they know they've had it. There's a second group of people who either haven't been tested at the right time, or didn't have symptoms, so didn't ask for a test, or people who may have had some symptoms but didn't actually take it seriously and don't know that they've had COVID. So that is a more difficult group. And when we get people like that, who have had symptoms but no test, we try to test for antibodies. Now, we expect that maybe 70–80% of people who've had COVID at some point will have positive antibodies. But we know that that is not for everyone. So there is at least 1 in 5 people who may not show antibodies or may not have produced antibodies, but may have had COVID. And they may also continue to do that. Now, we don't know enough about this particular group. And there are other people who may not have had an antibody test at the right time. And we know that antibody probably goes off after 6 months or so, and are now having symptoms 6 months later, but they can think back to 2 or 3 days of symptoms, but no test, no antibodies. What do you do with them? And I have a few of these patients who come to clinic. And when you look back at that time and you say, well, at this time, everybody in the United Kingdom was having COVID, and you had an illness, which was headache, fever, cough for 3 days or 5 days and all that, and you were in bed. So, 90% chance that that was COVID, but you don't know that at present, and we can't really prove that at present. We are still taking them seriously, because if they are showing signs of post-COVID syndrome or long COVID features, we would take them seriously and we would deal with that. So the advice to you would be, talk to your doctor, either talk to your GP, or the GP will talk to the local expert in the field, and they will work through your symptoms to decide, based on the timing, based on your exposure, whether the symptoms you had fit in with long COVID. The government hasn't quite made up its mind about, whether they will be included into the long COVID or not. If you have negative antibodies and negative test, whether you are considered. As doctors and nurses, we believe that if you've had it and you have the symptoms, irrespective of the test, you could still be considered long COVID. So we would treat you in the same way. And that is the same advice I would give.